Speaker, I don't know. I have fear, but even with that fear, allow me to join colleagues who have commended the Minister for Health for ever being alert and coming here to alert the country about diseases even before we raise anything as a matter of national importance. I remember the day the Minister stood here to warn us about COVID. That time it sounded like a far-fetched matter. In fact, some people were telling her to sit down so that we could discuss the issue of the locusts that had invaded Uganda. To some, it sounded very urgent and important. We did not realize then that COVID would cause such a magnitude of problems for us, including taking some of our colleagues who were present on that day when the minister was giving the alert. Since then, I've learned it the hard way, that whenever the Minister of Health comes here to tell the country about a disease, I listen attentively. Thank you, Madam Minister. I want first of all to put it on record, Mr. Speaker, that the people of Mukono I represent don't eat monkeys. Because a colleague, during his submission, brought it out on record that our people eat monkeys as a delicacy. However, in Mukono we treat monkeys as our distant relatives. Mr. Speaker, sir.
Honorable Nambooze, order from Dr. Tara.
Referred to our people, which I did not specify, and I did it intentionally by not naming specific tribes who eat monkeys, but I made it generally, because all the people of Uganda are our people. Is the precurrent holder of the floor in order to say I alluded to the people of Mukono as monkey eaters?
Thank you.
Is he in order?
Thank you. Now, Honorable Tara, why do you make all of us look suspicious? Her people, and even me, by the way, don't count me in that group. So. But anyway, it shouldn't be. We know there are people who do. Okay? Yeah, so let's not read so much into it.
And then allow me, for the sake of time, to go to my point. Mr. Speaker, the issue of hand washing, simple as it sounds, seems to be the miracle we need to, all the time, for every virus that has been mentioned apart from that of HIV. Hand washing has always been cited. Yet, Mr. Speaker, as a culture here, even some of us in the church, shaking hands among ourselves is a culture. I think it is high time, Mr. Speaker, we do two things through the Ministry of Health, care of public health, that we need to build a culture that discourages shaking of hands and hugging. Because it seems that in the modern world, we have more viruses coming up each and every day, and the contact is one sure way of spreading the diseases. To Mr. Speaker, all of us here in our constituencies, during the COVID epidemic, we installed hand washing centers in the markets, at offices, everywhere. But when you move around the country today, you will see that most of those installations have now broken down. I want to request the Minister of Health, as a matter of public health, can't we come up with a policy that make hand washing facilities be part of the requirements that every occupier of premises and housekeepers must keep, especially in public places, as a matter of policy. That even here, Mr. Speaker, used to provide us with hand washing facilities at Parliament. But apart from your place there, we no longer have them everywhere. Apart from you and the clerk, for us, you would find them at the gate, Mr. Speaker. But today they are not there. In markets, in schools, in all those public places, as a matter of policy that the country maintains an infrastructure for hand washing, and then the issue of discouraging shaking of hands, especially through my dear church, the Catholic Church. It is one of the things we must do during Mass, that we are required to show, to handshake as a show of friendship and comradeship between us, the faithful ones. Lastly, Mr. Speaker, maybe we shall in the future need a candidate who will be bold enough to say that if you elect me president, I will build a wall between Uganda and the DRC Congo. Thank you.
Yes, Honorable Musana.
Rebel activities as a result of the M23. There are several people crossing the border points, moving from DRC, coming into those districts that border DRC. And currently, in my district, we have several people who are coming from DRC, coming to Kagadi as a district, and then they are being moved to Changwali refugee scheme. Now, Changwali camp. Now, Mr. Speaker, I don't know how the minister is ready in mitigating those other issues that may come in, well knowing that the source of problem for our country, and together with a number of epidemics, are coming from these border points, well knowing Kasese, Bundibujo, Kagadi, and all those areas. Is there any mechanism the ministry is putting across in managing this cross-border movement as a result of the M23 and the other rebels? Thank you.
Thank you, Honorable Good.
That whenever there's a problem there, we will bring it to this country. Aware that ambulances are needed for emergency responses that may arise in this kind of situation. Honorable Minister, you know the President redirected the budget of ambulances to Roko, which was not our priority. So, if this kind of issue arises, the road is insecure, it has not been rehabilitated, the Ministry of Works cannot pay attention even when we report that it is a security risk, because people who are supposed to intervene on the border during those regional meetings for the matter to be listened to. Honorable Minister, communication, which was very elaborate during the COVID time. For a district like Maracha, what preparation have you put in place to empower the health workers and the people who manage our healthcare systems on risk communication? How will the population know that there's a risk and they are supposed to conduct themselves in a particular way in that part of the region, since they may have challenges with the language? And I did also say some of them speak Lingala, which is a Congolese language. How do we help our people in the border appreciate those challenges? I would love to hear what response frameworks you've put in place, one to address the issue of emergency response and the behavioral and other risk communications. Thank you.
To control mpox and other zoonotic diseases is to ensure that we minimize contact between the wild and the human beings. I've seen in our national parks people interacting with these wildlife freely, and that puts our people to danger. I believe by this time the Ministry of Health and Wildlife Authority, we ought to come up with guidelines on how to minimize contact with the wildlife. I've seen also in this city populations of monkeys moving around and bathing in the water tanks at the top of buildings. Every day in the morning you will see they are bathing, monkeys are bathing. And Right Honorable Speaker, this also exposes our population to these zoonotic diseases. I want to pray that again the Minister of Health and the Wildlife Authority, they find that they get the guidelines on how to help our people, first of all, minimize these populations of the wildlife that is loitering around this city, and also to ensure that whoever is going to have wildlife as a pet, that must be under a license. I'm seeing people having snakes, monkeys in their homes as pets, and sometimes this exposes them without their knowledge. I want to appreciate Right Honorable.
Honorable Minister.